And that's the beauty of what I do is I see people in their homes. I see what they struggle with. I see the refrigerator that's empty. I see that they haven't been able to get out to get their medications. So it's a one-on-one personal relationship with them.
Welcome to Mastering the Numbers. I'm your host, Joe Mallo. All right, hello everyone. This is Joe Mallo with the Lead Edge Consulting Group, powered by Focal Point Business and Executive Coaching. Welcome back to another episode of Mastering the Numbers. Today, I'm excited to have Roberta Brofman on the interview series. She's the president at 5-Star Clinical Solutions. Roberta, thanks for being a part of the interview series.
Well, thank you, Joe. I appreciate the opportunity to be here on your podcast.
Yeah, absolutely. I'm interested in finding out more, and I'm sure everybody out there is interested in finding out more about 5-Star Clinical Solutions. So, if you could do us a favor, tell us a little bit about 5-Star Clinical.
Sure. So, first of all, I'm a registered nurse, have been for many years, and have quite a breadth of experience as a clinician and as an administrator. Say that 5 times fast, right, Joe? And I started 5-Star Clinical Solutions about 7 years ago when I was working as a vice president of clinical services for a facility that had over 400 beds and was working, 60 hours a week at least. And someone said to me, "Why don't you start your own business? You have a lot of expertise." And I thought, gee, can I do that as a nurse? I wasn't quite sure. I do have an MBA, but I thought, not quite sure how to start a business. So 7 years ago, I started 5-Star Clinical Solutions, primarily as a consultant, a clinical consultant to hospitals, nursing homes, skilled nursing facilities, hospice, and home care to help them to improve their quality and get to that coveted 5-star level that the government gives you that seal of approval. And then about 5 years ago, I started part of my business as a patient advocate. And I help people, empower people with knowledge so that they can make the best possible decisions about their own healthcare. I say to people that our healthcare system is very broken, and I've never once had a person say to me, "Really? Is it?" They all go, "Yeah, it's very broken." Trying to get, and it's not just patients and consumers, the physicians, nurses, all are suffering as well with the confusing complex situation we have in our healthcare. So I function as a patient advocate. I am an independent practitioner. So I work for the client and for their family.
Great. So, besides the 60-hour work weeks, what inspired you to start your own business?
Well, the part of the business, as I said, that is for clinical consulting, which I still do, was basically born out of really wanting more independence in my own work-life balance, being able to call the shots and still use the expertise in the many years of experience that I have. The second portion, which is the patient advocacy piece, is a really interesting story, I think. About 5 years ago, my husband went in for what was supposed to be an overnight surgery. And we did our due diligence. We made sure we looked for the person who was supposed to be the best surgeon for this particular surgery. And again, it was supposed to be overnight. And my clinical expertise is excellent. And when he got to the recovery room, right away, I kind of like my spidey sense was going off. I thought something's not right. He had a lot of IV fluids going in. And after a couple hours, he still had no urine output. I thought something's not right. I brought it to their attention and they checked him out and they said, no, be calm. Everything's fine. We went to the unit and he sat up and passed out. And I said, I think he's bleeding internally. And I'm going to give you the short story because it's a very long story, but I kept saying something's wrong. I think he's bleeding internally. They finally agreed that I was correct after about 4 days. And I talked to the surgeon who didn't come in for like 3 or 4 days. And I said, I'm trying to think maybe he has an underlying bleeding disorder. And he quote unquote said to me, "Why don't you stop thinking and just be a wife?" And, even at the time I thought, well, maybe he's just trying to make sure I'm at ease and I'm not worried about him. And then he kept telling me he'll be home in a couple of days. And then finally I said, he's a sitting duck with all this blood in his abdomen. He can be a sitting duck for infection. And he said, no, he'll be home in a couple of days. And he continued to get worse. So I demanded that he be transferred to the intensive care unit. I will tell you that the senior resident even came downstairs and told me, no, you don't want to do that. He's got this beautiful room with a beautiful view and your visiting hours are going to be restricted. And at the time, I even thought to myself, I could be wrong and I could look very foolish, but I had a sixth sense that he was really in trouble. As soon as he got to the ICU, they didn't even touch him. They took one look at him and they said, he's in septic shock already. If we had even waited another hour, he would not have survived. So it made me really, bells and whistles went off and made me recognize the fact that had I not been there, he would have died. And everybody would have said, wow, that's so strange. He was so healthy. He was a runner before he went in, working full time, just must have been his time. It wasn't his time. And thank God that I was there. But most people don't have someone with them. So that's
Yeah.
really what prompted me to start the piece of the business that has to do with patient advocacy. And interestingly enough, I really saw no one doing this at the time I started about 5 years ago. There were navigators that help you to get placement in nursing homes, which I also do, but there wasn't someone who comprehensively looks at you or your family member from a clinical perspective. I joke that Elon Musk can send rockets into space. I can't do that, but I bet Elon Musk wouldn't have been able to figure out what was wrong with my husband. So it takes a different kind of experience and expertise to know what's happening and also be able to speak with the staff in a positive manner that isn't adversarial to get what you need in healthcare.
Yeah. Yeah, I think a lot of people need that. You and I spoke previously. I had a surgery about 7 years ago where it would have been really nice to have someone just like you, side by side with my wife while I was in there. So would have made things a lot easier, probably on me. But,
Mm-hmm.
so what have been some of the biggest challenges getting your business up and running?
Well, the first challenge was, I'm a nurse, right? So I'm a very good nurse and I'm a very good clinician, and I can speak with people and I can do all kinds of, different procedures and technical skills. But starting a business, even though I have an MBA, when you're in MBA school, they don't teach you how to start a business. They teach
Yeah.
you ROI and, economics, but they don't really say, here's how you actually begin a business. So I did get some help. I have a son who's an attorney, and he helped me to set up. It's a very simple process, really, as you well know, to set up the business. So that was the first hurdle. Then it was a matter of trying to figure out, okay, do I need a website? Do I need SEO? What do I do next? And I'm sure you're going to ask me a little bit more about running the business as a whole nother challenge. Starting it was one thing, but then how do you get the word out? You can't exactly put a billboard up that says patient advocate on 271. Everybody's going to go, what the heck is a patient advocate? So that was the initial challenge, I would say.
Yeah. Is there anything along the way that you would have done differently in starting the organization or growing the organization?
I don't think there's any, well, no, I don't think there's anything I would have done differently in starting the organization. What I'm seeing today is that there are more and more patient advocates cropping up. So it is a rife business to really grow. And that's one of the places where right now I'm trying to grow the business and figuring out what does that look like. I have some people on 1099s, but how far do you take that? Do you go national? Do you stay local? One of the things that's extremely important to me is quality, as I mentioned in the beginning. I would never hire someone that I don't know and that I have not worked with. I've worked with some outstanding nursing staff, and I would in a heartbeat have them. If I don't trust them with my care or my family's care, I wouldn't hire them to take care of any of my clients either. So that's been kind of the challenge, is how do you do that? How do you bring those
Yeah.
people on? And I remember when I first started, I was talking to somebody who had been in business for a long time, and one of the things he said to me, which is very true, while you're actually doing the business, so I'm out there seeing clients, you also have to grow the business. So,
Right.
and then what I find is it grows, and then you're really busy, and then you don't have time to market and network. So then things, patients fall off or their needs are already met, and you move on. So you really have to constantly grow the business as you're providing the care,
Yeah.
and that's
Yeah.
challenging.
Yeah. You almost have to have a perfect balance of efficiency in different
Yes.
areas to make sure that nothing is getting left behind. So, so you mentioned that there's more patient advocates starting to join the workforce, starting their businesses. How do you stay ahead of your competition?
It's an interesting question that you say competition. I really initially thought that, oh my goodness, I've got all this competition. I better be concerned. I'm not concerned. And it's not because, I mean, yes, I'm good at what I do. That's not the point. The point is I embrace those people and I network with those folks and we help one another. There are several that are national that I've spoken with, and they're in Florida, they're in different states, but they offer a similar. I even have a friend who's a physician who is has a company that does what I do, and she's given me referrals in Cleveland, and she's in a different state. I believe she's in Massachusetts, but the point is that there's plenty of work for all of us to go around, and it is a kind of in its infancy or toddlerhood stage. So all of us are kind of feeling our way around to figure out what's the perfect way to deliver this, and how do we fit into the current healthcare system? Are we completely apart from it? Do we mesh with it? I will tell you that sometimes when I initially will call discharge planners in the hospitals or the nursing homes, initially I would get this kind of like, who are you? What do you want? What, like I'm treading on their toes. And I make certain to let them know, no, we're here as partners for this client. The hospital doesn't want this patient after they discharge them to come back because that counts against them financially and in many other ways and quality measures. So it behooves all of us to really work together for that client. They can't possibly not only take care of them in the hospital, discharge them from the hospital or the skilled nursing facility, and keep in touch with them afterwards. So, I'm there to help extend the care and the quality after they discharge them. So I don't see them again as competitors. We really work together. I've even been asked to talk at different groups that have started that are national groups that are starting a similar process. So again, I don't see them as competitors. I see them as colleagues.
Yeah, everybody working together to help out. So I think
Mhm.
that's a great way to look at it. So within your industry, what you're doing for your patients, is there a part of is innovation or technology changes that help with your business, or is that not a big
Sure.
issue?
Um, you know, Technology, obviously, we know dirty word COVID, that helped us tremendously when we had technology to be able to have remote access to patients, to clients. Um, I think I get a little concerned, and of course, artificial intelligence, I'm very well aware of AI and how we use AI in healthcare. Um, but I also want to be careful because I think that one of the things that's happened in healthcare is we've lost the human touch. One of the first things we have to do is trust our provider. People don't know me when they first meet me from Adam. So the very first thing I have to do is listen to them, find out what their needs and their concerns are, create an individualized plan of care for them. It's not a one size fits all at all because every person in every situation is different, and help them to recognize that they can actually trust me, to follow through with what I said I was going to do. If I say I'm going to call their physician, I call. If I say I'm going to get in touch with their discharge planner and I'm going to get some kind of services involved when they go home, I do that. So I get a little concerned about using technology too much. I mean, you and I are right now are on technology, which is great.
Right.
There's nothing wrong with that. So I think it has its place. And I believe that healthcare right now is still trying to find its way to what that perfect balance actually is. If I have someone, obviously someone who is maybe elderly and infirm and can't get into a doctor's office, we can go online. We can go on a Zoom call with that physician, and I
Yeah.
can be present in that call with them, physically present, or even on technology. But I think that's where the bigger the organization gets and the farther away we as care providers get from that individual, the more impersonal it becomes. And, healthcare is transactional and it requires trust. And I have to be able to look that person in the eye, hold their hand, make contact with them, and have them understand that I'm there for them, exclusively for them. And that leads me to another point, which is, I stay independent. People will ask me sometimes, Well, do you work with a specific hospital or with a specific nursing home? No, yes, there are ombudsmen, and yes, they do their role, but the ombudsman that works for a hospital works for the hospital. I work for you and for your family
Yeah.
independently. I have nothing, I'm beholden to no one but you and your family. So, yes, technology has its place. But again, we're still, I think, trying to find our way into what that
Yeah.
looks like. And healthcare, quite frequently, quite honestly, is so complex because we have all these different specialists. You've got your radiologist, you've got your cardiologist, you've got your primary care doctor, and they're frustrated too because your primary care doctor is supposed to see patients every 10 to 15 minutes. How do you develop any kind of rapport with your client and with your patient as a human being and as an individual? You can't do that. And that's the beauty of what I do is I see people in their homes. I see what they struggle with. I see the refrigerator that's empty. I see that they haven't been able to get out to get their medications. So it's a one-on-one personal relationship with them.
Yeah. I think that's critical. Even though the televisits that you can do with doctors now are extremely convenient, I think in a lot of instances, having that personal touch is so much more important, you know,
Yeah.
unless it's just I have allergies and I need some allergy
Right.
pills.
Right. And
But
there's a place for that. Well, and not everybody can manage technology either. I do
yeah,
have clients that don't have access to technology. They don't have a
yeah,
laptop. They don't have Wi-Fi. It's hard to
right,
believe, but they just don't. They don't, and they don't want it either.
right, right, absolutely. So we have to accommodate them as well. So
Sure.
you mentioned at the very beginning of this interview, you brought up balance, right? Professional and personal balance. How do you find yourself able to find a balance between your personal and professional life?
I would say that owning my own business has allowed me the privilege of having that balance. So, I can push and get more clients. I can really work hard to grow the business, or I can say, okay, a couple clients are done. We've helped them. They're happy with services. Services have ended. They can contact me if they want in the future. I don't necessarily have to grow the business at that moment. Sometimes it's as many businesses, sometimes it's crazy. Sometimes it's really, really busy. And the other issue is that not every client is the same. So I may have 25 patients at a time, myself as an individual, or 30 patients. And some of them can be once a month visits, which is what I generally do. And they're fairly, not complex. Some of them are extremely complex. Some of them end up in the emergency department, and I need to go to the ED and I need to talk to their doctors and I have to help them with medications. And, maybe they've got a wound that needs to be dressed. Maybe the things are really falling apart and nobody's communicating with one another. So they become more intense. It just depends on their individual needs and what they need. Some of them have family members that are pretty helpful and can step in and make visits where maybe someone else has no one and they need me more. So, I try to control that as much as I possibly can. One of the beauties about what I do is that if I want to go on, let's say, a vacation, I want to go out of town, visit some family, I make sure that every visit is up to date and I can still stay in touch with people even if I'm not in my office. So, it's fairly easy. Sometimes I'm not going to lie. Sometimes it gets a little intense. It gets a little crazy. I would say that the visits are not what is challenging. Sometimes the documentation takes time, and I'm a stickler about documentation. If
Yeah,
you don't write it down, it didn't happen. So I really make sure that I chronicle everything that happens, every little detail that
yeah.
happens, and that takes a lot of time.
It does. So with that added flexibility that owning your business provides, how do you maintain your focus and your motivation to continue to grow or maintain your business?
I think, like any other human being, we all wax and wane, right? There's times when we
Sure.
just kind of say, "Okay, I need to just watch something on TV and just chill for a little while." Um, One of the things that I do quite a bit, and you and I have talked about this before, is networking. So again, I can't put a billboard up on 271 and say, "Call Roberta, the patient advocate. She's trustworthy." people are just going to drive by and go, what the heck is that? It's different if you have a roofing company and you say, call, MAP Construction, they're great roofers. Okay, I need a roof. I call that guy. But what the heck is a patient advocate? You can't quite, convey what that is in a billboard. So networking is extremely important to me. And um, when I catch myself kind of, I mean, absolutely, I make sure every patient is well cared for. If I catch myself saying, well, I'm doing okay, I can kind of skate, I just give myself a kick in the bottom and say, you got to get going, because you just don't know. Things happen. Sometimes people pass away, and there's nothing that we've done wrong. They might be 100 years old. We've had some clients like that, and we have helped them through that process.
Yeah.
But patients fall off, and then you have to refresh and renew. So I think really what's important is referrals from your own current clients and from people like yourself, Joe, who know me, trust me. And it's also important to reciprocate, because I can't do absolutely everything. I'm not a physical therapist. I can't redesign your home, but I know that it needs to be done, or I know that you need a specialist for something like that. And we've got some
Right.
great success stories where we've helped people to stay in their homes by working with other consultants who help us to make the home safe and help people to stay safe in their home. So, networking is a two-way sword. A two-way process, because I can get referrals from people, but I can also need their services for my clients, which
Right.
is critical, really
Right.
critical.
Yeah, I've found networking and talking to individuals about what I do and what they do has been very valuable
Mm-hmm.
um, in growing my business as well. So I agree. So for those individuals that may want to become a patient advocate, what do you find most challenging about that industry?
I think the most challenging thing is getting the word out there. I'm confident in my skill set, and it's important that you stay active and up to date. There are new clinical things that occur. Reading and researching is really important. Staying active in your profession is very important. Um, and it just you just really have to stay current. I would say
Yeah.
is the most important thing.
Yeah, I think that's for a lot of industries out there and a lot of career paths. You have to stay
Yeah,
current. You have to stay ahead.
yeah.
Um,
And
so,
Joe, there are
oh,
some
sure.
people who go into patient advocacy who have been patients and have been frustrated and decide to start their own business. And there's a special place for that too. What I provide, and I think other nurses provide, and there are social workers who do this as well. They have great resources out there, is the clinical aspect of things,
Yeah,
which I think is critical, because being able to talk the lingo with the surgeon, with the physicians, and really kind of being the quarterback of your care. Because again, like I say, we have this circle of supportive services, like your endocrinologist, your cardiologist, your this, your that. They
yeah,
don't all talk to each other. And so you, as the hub of that patient's care, can coordinate. Sometimes I see patients, I always do a medical medication reconciliation. And sometimes I'll find that people are on a medication that is treating a side effect of another medication, but they were both prescribed by different physicians.
right.
And sometimes when you go in, I will give you a big tip. When you go into your doctor's visits, make sure that you go through all your medications that are listed, because you may have ones that are on there that you no longer take, or ones that you started that aren't on there, or a dosage that has changed. So it's really critical that your physician or nurse practitioner knows what you're actually taking before they prescribe or discontinue something.
Yeah, absolutely. I'm sure that because of your experience over the years and your expertise in the clinical side of it, I have no doubt that someone who didn't have that probably wouldn't have come up with the same diagnosis as you did in the situation you were describing with your husband. So I agree. All that experience is critical.
Yeah, I
Um,
think I mentioned to you, Joe, when we met, that I just developed a program, a whole course for people who want to become a patient advocate. And I'm looking to put that online as an online program so people can learn how to do this, because I think it is critically important that even if you don't, even if you don't hire me, you need to know what you're doing and how to advocate for your
Right.
loved one.
Right. Is that information on your website?
It isn't yet. It isn't yet,
Okay.
but I can give you my website and you can communicate with me through the website. My email is on there and contact information.
Okay.
So that is
Uh,
Roberta at fivestarclinical.com. And that the five is the word five, not the number five. So Roberta at fivestarclinical.com.
all right. Great. So,
Mm-hmm.
Roberta, where do you see your business in the next 12 to 36 months?
I would say growing, making more connections. I work a lot with elder law attorneys and financial planners. So making more connections with those folks, hiring on new nurses that I trust, looking at developing the company so that at some point in life, I will be able to turn this company over to someone else. And I think, a great bit of business advice that I recently received from someone who's very successful is to have people kind of have a stakehold in the business so that they can eventually take that business over. So growing the business, like I say, and also I'm really anxious to put this course that I have online. I think it's important to be able to mentor other people that want to do what I'm doing. And there is a huge need out there. I can't tell you how many people I talk to that'll say, oh my gosh, I wish I knew you last year because my mom went through this terrible situation, or my mom really, we
Yeah.
needed help trying to figure out what to do with my father. And you would have been so helpful. So
Yeah.
there's a
Yeah,
need.
you said something there as far as exit planning, having someone in place. I think that's critical is to you have to prepare your business for sale years before it's even sold. If you want to get the most out of it, if you want the business to last, if you want it to continue its trajectory. So it's always important to have somebody in place that you trust that's going to take over in the
Yes.
end. So I
Yes.
completely agree. Final question for you: if you ran into somebody that had started a business, but let's say they were struggling. They're 1 or 2 years in, they're struggling, they're stressed, they're frustrated. What type of advice would you give them?
The first thing I would say is don't be afraid to ask for help. Joe, you're a perfect person to help people grow their business. I think sometimes we think we have to be all things to all people. And as I mentioned, I do have an MBA, but they didn't teach me necessarily how to grow a business or how to
Right.
hire new people. They taught me what an ROI was, or what economics was, which is great. That's helpful. But I would say don't be ashamed or afraid to ask for help, because you can't possibly know everything. I mean,
Yeah.
even if you want to do search engine optimization, I'm a nurse, I'm a clinician, I'm great at what I do there, but that doesn't mean I'm great at figuring out how to build a website. I mean, I found help. We started out with kind of a, you know, simple website. And then I went to people and said, please, can you show me? Can you help me? Can you build this website out for me? I had actually one of my sons wrote the music for, if you look at the video on there, he wrote the background music for the video that's there that explains what I do. So reaching out to other people and not just thinking that you have to do absolutely everything together, which is one of the reasons that I say I don't see my competitors as competitors. I see them as colleagues, because we're all in this kind of new world trying to figure out how do we help people and what does this business model really look like and how do we improve with one another.
Yeah, absolutely. Not to be repetitive on my side, but I read an article. I will be repetitive. I read an article about 3 or 4 months ago, and they were talking about the top 10 reasons why businesses fail, and 9 of the top 10 were all some variation of unwillingness to ask for help.
Yep.
So
I'm not surprised.
um,
And it took me a long
not
time to
surprised at
do
all.
that. It took me a long time to figure out that I should ask for help, because you somehow think you've got to be all things to all people and figure out how to do everything because other people did it, but you don't
Yeah,
realize they got help. They had
yeah,
help to figure this out. That's why we have experts like yourself in business,
yeah.
that help people like me and others who are starting a business and growing their business.
Right. Yep, they ask for help. So we'll close on that. Ask for help if you need it. So, Roberta, I really appreciate you taking part in the interview series today. I learned a lot more today than I learned the last time we sat down, which is great. Once again, if anybody wants to get in touch with you, is your website still the best place to go?
They can go on the website, but they can also email me directly. It is Roberta, Roberta, at fivestarclinical.com. And again, that's the word five, not the number. So it's Roberta at fivestarclinical.com. And I will answer you same day.
All right, great. Listen, I really appreciate you taking part, and everybody out there listening, thank you for attending another episode of Mastering the Numbers. Roberta, take care.
Thank you so much, Joe. You too.
You've just tuned into another episode of Mastering the Numbers. We hope you found valuable insight to boost your financial success. Be sure to subscribe on your favorite platform and leave us a review. Keep pushing forward, and thanks for listening.